Should you be using ice on your face? So I had made this video on Alia Bhatt taking an ice water facial, and on this video I had said that you should not apply ice on the face. It seemed to confuse a lot of people. So in this video I'm going to tell you what does ice do to your skin, what is the best way to use it, when are the conditions in which you should avoid it, what to expect from it, and what it will not do. We'll cover everything in detail. Let's get started. So what does ice do to the skin? Ice causes vasoconstriction, which basically means that it shrinks the blood vessels to the skin. So this will instantly make the skin look less puffy. If you have puffiness under the eyes, or if you are somebody who gets puffy in the morning time, then you feel that when you apply ice or you take an ice water dunk, then the puffiness goes down. Also, if you have redness on your skin, because there is shrinkage of the blood vessels, the redness also tends to reduce. Your open pores tends to look lesser for some time because it shrinks the pores because of the change in temperature. So these are the changes that you can expect after using ice. Also, if you have acne on your skin, then because of icing, it can reduce the redness and the swelling that is associated with acne, and for some time make you feel that the acne has reduced in size. So why is it so popular? Because it is so easily available. Ice is there in every household, and also because it's natural. So a lot of people feel that anything that's natural is definitely good for the skin, and nothing bad can happen to the skin if you use any natural remedy. So I will tell you now that in which conditions you should use this and which conditions you should not. So when do we recommend icing? As doctors, we do recommend ice packs or icing under certain conditions. First is bruising. Let's say after you've taken any kind of injections on your skin, like a skin booster injection, or even if you've done Botox or filler injection, we might tell you to apply a little bit of ice if you feel that the area is a little swollen. Or if you have bruising, like you've hit something and you have a blunt bruise, then also you can apply a little bit of ice initially for the first 1 or 2 days in order to reduce the swelling. In cases of allergies, we do prescribe cold compresses. If you have atopic dermatitis, then taking cold compresses can help in reducing the irritation. If you have allergies, then with cold compresses, the allergic reaction can become a little better. In cases of conjunctivitis, if you have pink eye, then also we recommend using ice in that area to reduce the amount of redness, to cause vasoconstriction so that there is reduced amount of blood flow to that area, and icing can also help in reducing the swelling that is associated with conjunctivitis. If you have puffiness under the eyes, you get up in the morning and you feel that your skin looks puffy, then also you can use maybe an ice globe or an ice roller under the eyes for a few seconds. This can help in reducing puffiness under the eyes. If you have certain infections, let's say an acute furuncle, or if you have an infected sebaceous cyst, that condition also we might ask you to ice that area for some time, maybe a day or two, just to reduce the swelling in the area and to reduce the redness in the area. In cases of itching, sometimes itching can also be relieved with ice packs, especially if you have acute urticaria just in a few areas, then applying a little bit of ice can give relief. We also ask you to use ice packs in acute injury, let's say a muscle injury or a joint injury, just in the first phase, maybe for 1 or 2 days after injury. So these are conditions in which icing the area can help. So now I'll tell you the best way to use icing. Do not use ice directly on the skin. This can lead to ice burns. Okay, so don't rub an ice cube on the skin. I have seen real terrible cases of ice burns, so please don't do it. If you do want to use ice, you can wrap it in a thin towel or a thin handkerchief and then use it on the skin. This will reduce the chances of ice burn. If you want to reduce puffiness, then definitely washing your face with ice water is better than rubbing an ice cube on your face. You can also use ice globes. This tends to distribute the cold temperature in a more uniform manner than with an ice cube. So using ice globes or a cold spoon under the eyes is a safer alternative to using ice cubes. If you are somebody who likes to use something cold on the skin, then you can even keep a toner, let's say a rose water or a green tea toner, in the refrigerator and use it on your face. Just spritz it on your face in the morning. This will also give a cooling effect. If you are somebody who likes to use ice off to reduce redness, then you can even use a cold moisturizer. You can put your moisturizer in the refrigerator and use that over your skin. This will also help in reducing the redness and soothing and cooling your skin. You can use cold aloe vera gel. Aloe vera gel can be stored in the refrigerator and applied it on the skin. This can also be used on any kind of irritated area. If you have a sunburn or if you have any rash, aloe vera gel, which is cold, can help in soothing the area and reducing redness and irritation. So now I'll tell you who should absolutely avoid ice. If you have rosacea. Rosacea is a condition where you get a lot of redness on the cheeks, on the forehead, on the nose and on the chin. People with mild rosacea tend to think they have sensitive skin. So people with sensitive skin and rosacea really need to avoid using any kind of ice on the skin. This icing, ice water dunks can irritate the skin, can dry the skin out and make things worse. It can even rupture blood vessels on the skin surface. So if you have rosacea, please stay away from it. Icing can lead to more drying of the skin, and because the skin barrier is damaged, it can lead to more irritation. So that's why it's best to use, like I said, like a cold moisturizer if you wish, or a toner that you put it in the fridge and spritz it. That is better than using ice on your skin. So like I said before, if you have rosacea or sensitive skin, don't use ice on the skin. It'll just make things worse, make your skin more red and irritated. If you have something called cold induced urticaria, it's a condition when you're exposed to cold, then it leads to hives or rashes on the skin like this. So this can lead to a lot of itching, irritation, and can be very uncomfortable. So if you have something like this, then you want to stay away from using ice or ice water on your skin. Now I'll answer some very frequently asked questions. How long do results of ice facials last? These results are temporary. There is no long-term improvement in the skin when you do this ice rubbing or ice facials. They do not have a long-term effect. All the results that you see are temporary. Does it help in stimulate collagen? Absolutely not. Icing your skin or taking any kind of facial will not help in stimulating collagen at all. Does it help in improve penetration of skincare products? No, it does not. It does not improve the penetration of skincare products, will not make your actives work better. Not at all. Does it help in reducing acne? Maybe temporarily it can help in reducing the swelling and the redness associated with acne, but does it have any long-term benefits on acne-prone skin? No. None. Icing has no long-term benefits on acne-prone skin. Can I ice my face daily? Will it cause any harm? I would say it can really irritate and dry your skin out in the long run. If you want to use icing on the face, like with ice water, or wrap on ice cube and apply it on your face, maybe you can do it before an event, or when you want your makeup to look a little flawless, or when your skin is a little irritated, maybe to reduce the redness, you could do it. But you have to be careful, and doing it daily has no benefit. Okay, so you can keep it only for occasions when you want your makeup to look better, or you want your pores to shrink temporarily. That's it. It has no long-term benefits whatsoever. So there you go, a detailed video on ice on skin. I get asked this very often. A lot of people feel that applying ice on their skin makes them look rejuvenated, fresher, better, and they feel that regular icing does help their skin. I would not ask you to stop it. If you feel and if you see the benefits, it works for you, it does not cause any irritation, go ahead and do it. Not a problem. It's not something that can completely harm your skin. But if you are somebody who is being introduced into this, who has not been doing this regularly, or you have dry skin, sensitive skin, or rosacea skin, then please be careful, as this does not carry any long-term benefit. I hope you found this video useful. If you like to watch the skin and hair related content, you can follow me on my Instagram handle Dr. Achal MD, where I post skin and hair related content daily. Thank you for watching.